rise in popularity of synthetic drugs, it is becoming increasingly dangerous for the public to consume these drugs.
Prince Albert City police officers and firefighters will now carry a drug antidote kit. The nasal spray naloxone will be administered to people who may have overdosed on opioids like fentanyl, carfentanil, morphine, and heroin.
Primarily, we will allow medical responders to provide medical assistance. In absence of that, this is available to our members, and they can weigh the totality of the event, and if safe to do so, that is an option for them to use on a member of the public.
A high risk of mortality from these drugs and a rise in their use prompted the department to get the kits. They're following the lead of RCMP and other police forces across the country. The health region says ER visits for drug overdoses are common, and having officers with the kits may save lives.
Coming through the emergency department is the first kind of line that we see those clients coming through. It would definitely be a weekly occurrence in our community.
There's also a risk for officers involved in drug seizure and handling evidence to be accidentally exposed. In 2013, Saskatchewan had 10 fentanyl-related deaths.
In 2014, 11. In 2015, 22 fentanyl-related deaths were reported in the province.
The intranasal spray is not available to the public, but the province is providing injectable naloxone through Access Place. Steve Ma is the manager of Access Place and Outreach Services.
So there's a short window that obviously exists when someone is overdosing, and the sooner we get emergency services notified, the increased likelihood that individual has to have their life saved.
Naloxone distribution started in January. People who identify themselves as high risk of opioid use and family members of addicts have accessed the antidote. So far, 15 kits have been given out.
Sometimes they won't be able to use it on themselves, but if they're with someone who has the signs and symptoms of an overdose, they have the training and skill set required to use them and ultimately save their life.
Pharmacists can also dispense naloxone, but Ma urges the public to get trained on how to administer it and learn the signs of an overdose. His staff provide detailed instruction to everyone who takes home a kit. Reporting in Prince Albert, I'm Lisa Risom.